Back pain, one of us here has it. In this edition of 3-Minute 3-Tip Tuesday, I'm going to be showing you my top 3 remedies. Hopefully gonna work. Hello, welcome back to my channel. If you're new, welcome. If you've yet to do so, I encourage you to get a copy of my free book. You can click the link in the box below for more information. Back pain in dogs, cats, people. I did tell you guys that one of us here has it. It just so happens that it is not the poodle. My undoing, or at least cause of it, had to drive out of town, had to drive for about 4 hours there and back, spent a couple hours in a dental chair, kind of compressed, which, I think just all that sitting, all that back compression kind of tweaked it out. And I'm walking like this, not like this. They see me from the side, I seem kind of bent, because I feel bent. And not bent mentally, not mentally, but no, point physically, literally. Back is in spasm. I'm putting 3 minutes on the clock, starting now. What are the signs of a back pain in your dog, your cat, yourself? Well, you know yourself. Typically it's this lower lumbar spine. The big supportive muscles on either side of the spine are in spasm. You've strained them, you've done something to overwork your back, much the same thing in your dogs. If Tula here were to have back pain, typically what you would see, or what I would see in practice, is an animal, they may be favoring their leg, one side or the other. They may be holding their sort of neck down, reluctant to lift it up, reluctant to move it side to side. Or they just may be walking around, walking into the clinic, just really stiffly. They're not, fully extending or, flexing those front legs. And you can imagine yourself, right? When you've got that back in spasm, everything else is really guarded and sore. If I were to do a physical exam of Tula, say I saw her walking in, seemed to be really hesitant, reluctant to move these rear limbs, really guarded, might palpate on either side of the spine here with my thumbs, and I would expect to find, when I'm putting a moderate amount of pressure, I might feel an actual knot in the muscle, these big muscle bellies adjacent to the spine, or when I put a bit of pressure, she might actually be sore. She might turn her head to have a look and see, like, what am I doing? The first one I want to start with, kind of been my new favorite lately, CBD, small amount of THC, orally and topically. So this is CBD in combination with THC. This is a 4-to-1 tincture, so 4 parts CBD, 1 part THC. If all you can get is CBD, that's the non-psychoactive cannabinoid from the cannabis plant. If that's all you can get, that's fine. It's going to give some good pain relief for our dogs and cats, potentially for yourself. You can even get additional pain relief if it can come in combination with THC. A standard dose when we're dosing our dogs and cats is 1 milligram of CBD per 10 pounds of body weight daily. This CBD has 300 milligrams of CBD in total in a 30 mils of a bottle of MCT oil is the carrier oil, meaning that and it's 20 drops per mil. So meaning that every 2 drops gives you 1 milligram. Tula's dose would be approximately 4 drops twice a day. That would be 2 milligrams twice daily. My dose is going to be 1 cc, which is 10 milligrams of CBD, 2.5 milligrams THC, and that is what I'm taking now. And if you happen to see me in future videos being more relaxed, you know why. The other thing is I'm going to use it topically as well. So this is a CBD THC cream, which I don't know if you guys need to see the gory details as I put it on myself. Just some flesh, okay, Tula. But I find it works. It's also worked really well. So I'm just, as much flesh as you want to see. But I'm just rubbing on the lower part of my back. And I just found that for, especially at night, it was penetrating into the skin. So as well as orally, as well as I can also use it topically. Gave me some really good pain relief. So you can apply that same principle to your dogs and cats. The next thing I want to have you guys consider is the use of something that's going to act as a muscle relaxant as well. The best natural one that we have is this. It's Valerian extract. You're looking at Valerian doses of about a half a ml of the tincture. I want you to shake it well first. For 20 pounds of body weight, 2 to 3 times a day. Easily be given 3 times a day in an acute situation, you know, or someone's got a muscle spasm. I myself am going to take another dropper full, which is a ml of it, to give myself some natural muscle spasm relief. So, let's see how much of this we can get. Well, here we go. Oh man, you know the THC, CBD, that tincture tastes so much better. God, no wonder the animals don't like it. It's horrible tasting. The third thing is you're thinking of reaching for the aspirin. You want to give some type of anti-inflammatory. Is there something that you can give naturally? You bet there is. I'm going to take some myself right now. This, the 95% curcumin. We're looking at animal doses of about 100 milligrams per 10 pounds of body weight. You can start out at once daily. Easily increase that up to twice daily. These are 400 milligram capsules. For a human dose, I'm going to take 3 of them. Good 1,000 milligrams Tula. So Tula's dose would be about a half of one of these capsules, or 400 milligram capsules, twice a day. It's really important that they're given with something fatty, like a fatty meal as well, so you get much higher percent of the curcumin gets absorbed. One study I read, they compared curcumin in combination with another herb, Boswellia, was more effective than a traditional anti-inflammatory called naproxen, which is huge. So like, man, reach for it as a first line defense for an anti-inflammatory. Here's my 3, not for you, for me. Angela, here we go. Beta green tea, 9% curcumin, Valerian, CBD, THC, stuff topically. I'm gonna feel so good in 30 minutes. I'll give you an update in the following video and tell you how things worked out. Thanks so much for watching this edition of 3 Minute 3 Tip Tuesday. If you've yet to do so, I encourage you to get a copy of my free book. You can click the link in the box below for more information.